Hello, I'm Dr. Paul Byrne. I'm a physician who has studied the issues about the right to life for many years. The rights of the patient are based on the natural law and the natural moral law. The natural law has to do with what's written into the hearts of every one of us, and the natural moral law has to do with how we deal with each other. All men are created equally, endowed with certain unalienable rights, the right to life, liberty, and the pursuit of happiness. Liberty is a special word. It comes from putting together two Latin words, liberum and arbitrium. Liberum means desires. Arbitrium means mastery. In Latin, the words are often reversed, so it's mastery over desires. Mastery over desires is to do good and avoid evil. And of course, as we grow in our life, why, that's where our conscience is, and that's where the right to privacy stems from. Our life is a gift, and once we get on earth, the life is a continuum. Early life is spent inside the uterus. There are certain events that are very exciting, like being born is very exciting. There are other things that have to do with graduations and matrimony and the like, when life has its ups and downs, but once it begins, life is a continuum until true death. This slide that I show you has some ups and downs, and eventually life on earth ends, and at that time that label has been called death. Death is when the soul separates from the body. During our entire time of life on earth, there's a unity of the physical and the spiritual, a unity of the body and the soul, and it can't be separated during the time that we are on earth. There are inalienable rights to life, liberty, and the pursuit of happiness. What can a doctor do but protect and preserve life? As long as the person is alive, the doctor can have a patient. The person is living until dead. Euthanasia is a word that means imposed death. The Greek is good, EU is good, thanasia is death. Imposed death is not a good thing to do. Doctors ought never impose death. Brain death gets involved in all of these issues. Brain death is not true death. It never was, and it never will be. And the reason brain death was invented so that they could get beating hearts and other organs for transplantation. The relationship between the physician and the patient is based on the standard of an intrinsic worth, that the patient's life has value and is always valuable. What can the doctor do but protect and preserve life? Doctors do that, nurses do that, respiratory therapists, and it isn't just doctors and nurses that protect and preserve life. Parents protect and preserve the life of their children. The policemen protect and preserve life. The firemen. So protect and preserve are special words, but the doctor has the special privilege to protect and preserve the life of God's special creatures. Those are persons. In the modern times, when there's so much attack on life, it behooves the doctor and the nurse to defend life. And when we're protecting and preserving and defending life, we're always postponing death. How did brain death get started? It started in 1967 when they did the first heart transplant. In 1968, the Harvard Committee invented the words brain death. 3 days after the first heart transplant, the second heart transplant was done. It was done on a baby who was brought to Brooklyn, New York, a 3-day-old baby. They cut the beating heart out of that baby and transplanted it into an 18-day-old baby. These were innocent victims. The Harvard Committee came about in 1968 because they had already done a heart transplant here in the United States, and prior to that, they did one in South Africa. These transplants were illegal, and they were immoral, And so they needed to solve the problem. So how did they solve it? But they set up a committee at Harvard. The objective of that committee was to come up with a way so that they could get beating hearts for transplantation. They took patients who were in coma and then just considered them to be brain dead. They didn't do any studies on dogs or cats or rats. They didn't even collect any patient data. They just published the article in the Journal of the American Medical Association. And the title of the article was a definition of irreversible coma. And in that article, they translated coma into death. They had no proof of true death. Prior to the Harvard committee, doctors and the law followed what was called Black's Law Dictionary definition of death, which said that death was when there was no circulation and no respiration and no response on the patient. So brain death was just invented, concocted, conjured in order to get organs for transplantation. This is a picture of the second heart transplant that was done 3 days after the first one. You can see this little baby is packed in ice. He's a very normal baby, except that he has something wrong with his brain. But he had a normal heart, and so they packed him in ice in case you can't imagine, it's not very nice to be packed in ice. They packed him in ice to reduce his metabolism and then proceeded to cut out his beating heart and give it to another baby who seemed to be more deserving of a heart because the other baby did not have mental retardation like this one did. At the end of that time, both babies were dead. It was illegal, it was immoral, and they still wanted to do transplants. So they brought together a committee at Harvard, the Harvard committee, who then set out to find a way to invent brain death so that they could get organs for transplantation. In organ transplantation, there's little or no information given to the donor. We go to the License Bureau and they ask, do you wish to be an organ donor? And everyone says yes or says no to that. They're not given any information. They're not told anything about what to expect. But of course, and then who do they take advantage of? They take advantage of the teenagers, the ones that are learning to drive, the ones that are getting learning permits. They ask them just to get the permit. They ask them, do you wish to be an organ donor? And teenagers can say yes or say no to that. Incidentally, when you or the teenager or anyone says no to that question, it does not get recorded anyplace. It's only the yes answer that gets recorded. They take advantage of the teenagers. They take advantage of the parents. Hospital administrators know little or nothing about these things. Coroners get involved. Friends can make the decision to give you organs. To get organs for transplantation, they must be healthy organs. They cannot come from somebody who is truly dead. In the course of declaring someone brain dead, they do what I would call a pull-the-plug apnea test. And what that is that the patient has a brain injury and is on a ventilator and needs the ventilator to help to protect and preserve their life, to support the vital activity of breathing. And what they do is they do the apnea test, and in that test they take away the ventilator. They take away the ventilator for up to 10 minutes. Now, the way you and I breathe is we take a breath every 3 to 5 seconds. And when the patient is on a ventilator, we give them a breath every 3 to 5 seconds. Well, they take away the ventilator, not for 30 seconds, not for a minute, not for 2 minutes, but up to 10 minutes. During that time, the carbon dioxide builds up, and when the carbon dioxide builds up, that makes the brain swell and makes the condition get worse. It can even cause the death of the person. No one should have an apnea test, so you have to learn, say no to the apnea test. If you compare living persons and brain-dead patients and those that are truly dead, the living person has a beating heart, circulation, has normal body temperature, the living person can be on a ventilator. The ventilator pushes the air in, but the ventilator doesn't push the air out. If the person is on a ventilator, the person himself or herself pushes the air out. They have respiration. They do heal, and cooling will slow their metabolism. Likewise, when somebody is brain dead, they have a beating heart, they have circulation, they are warm, normal body temperature. The ventilator pushes air into them, but they push the air out. And as a result of the ventilator, they do have respiration. And yes, those called brain dead heal. The cooling slows their metabolism. Now, if you compare that to someone who's truly dead, there is no beating heart, there's no circulation. They get cold quickly and equilibrate with room temperature. The ventilator pushes the air in, but it doesn't come out. It's only in the living person that the ventilator will be effective at supporting their breathing. There is no healing when someone is when it's the remains of someone, when it's a cadaver. Cooling slows the disintegration, but once someone goes from being alive to being dead, what there is disintegration, dissolution, destruction, and it's continuous and ongoing. To live on earth, we need circulation. The circulation has to do with the blood. The blood carries the oxygen. The respiration is necessary to live on earth. In respiration, the oxygen goes in, carbon dioxide comes out. It occurs in the lungs, and it occurs in all of the tissues of the body. We need water. We need food. We need a proper temperature to help maintain our body temperature. We need the environment to help us to do that. We need exits for stool and for urine. And there's hundreds and thousands of reactions going on in our body. We enumerate circulation and respiration and those kinds of things. Of course, they're important, but there are many, many other reactions going on in the living person. The circulation of the heart is just fascinating, but the heart, while itself is an organ that pumps blood both to the lungs and pumps blood to the rest of the circulation of the body, but the heart is a special organ, not just a pump, but also the center of love, and it's an important organ that in the transplant business, they make it just like they can cut it out and transplant it into someone else. Well, every time a heart is transplanted, it's a beating heart that's cut out of a living person, and after the beating heart is cut out, the living person is always dead. Yeah, the respiratory system is there for respiration, which is necessary for life on earth. We inhale the air with the oxygen, and we exhale the carbon dioxide and goes out into the air. The oxygen goes in, carbon dioxide goes out. The trachea and the lungs are designed for this, and the ventilator pushes the air into the trachea, goes down into the lungs. There are millions of alveoli. Alveoli are the tiny little air passages where the exchange of oxygen and carbon dioxide takes place. Right next to where the exchange takes place are little blood vessels that circulate and to give up the carbon dioxide and to pick up the oxygen. And it's just fascinating when you look at the microscopic picture of the lungs. The ventilator is a treatment that pushes air into the trachea, and it's effective in a living person. The elastic properties of the living person pushes the air out. If the ventilator is working, it's a living person. A corpse can have a ventilator push air in, but in a very short time, the elastic properties are lost and the air will not come out. We become dead quickly without circulation and respiration. We know that when we take a course on CPR. We know that we have to initiate the help for breathing within 4 to 5 minutes, and we know that without that help, damage occurs quickly to the heart, to the brain, to the lungs. Without oxygen, we're dead in minutes. Without water, we're dead in 1 to 2 weeks. Without food, we're dead in 1 to 2 months. So we need to live on Earth. We need a supply of oxygen. We need water, and we need food. Death is a negative. It's an absence of life. We apply the word dead to the body that's without life. The remains of someone, once we go from being alive and to being dead, that is, once the soul separates from the body, what there is disintegration, dissolution, destruction, corruption, decay, putrefaction, and it goes on. We can slow it down by cooling or embalming or whatever, or other means like that. But once we go from being alive into being dead, and it's a continuous process. After true death, and the word is mors vira, after true death, what remains on earth is a dead body, a corpse, a cadaver. The cadaver is empty, and after true death, what we have is a cadaver. The cadaver's not breathing. There is no heartbeat. There's no pulse. There's no blood pressure. There's no circulation. The cadaver is unresponsive to all stimuli, not moving. The cadaver gets cold, poor color, the nails and mucous membranes, and quickly becomes stiff. If the patient is on a ventilator, the air will go in, the chest will expand, but does not exhale. The difference between life and death is the kind of thing that we all learn as we grow up. We learn it when we play with the caterpillar. And suddenly the caterpillar becomes unresponsive. We know it when we have a fish and we wake up in the morning and the fish is not swimming around but is actually floating on the side. Sometimes the gill will still move a bit, but we know that fish isn't dead at that time. And so we continue to take care of that fish until death is truly there. And we can tell the difference between life and death of the fish, of the caterpillar, and of the person. And a person is living until dead. And during our time on earth, we have a beating heart, circulation, and respiration. And when someone says that about brain dead, when the brain isn't functioning, but the heart's beating and there's circulation and respiration, they're just not following common sense. Life on earth is a continuum from its beginning until true death. No one should be declared dead until there is destruction of the circulatory, the respiratory system, and the entire brain. Thank you very much.